Welcome to the module on reviewing transition goals. This module involves working in partnership with the patient and family to regularly set, prioritize, and review the patient's transition goals. It provides strategies, tips, and resources to do this optimally in practice. Finally, it provides quality improvement strategies and ideas to apply in plan, do, study, act cycles. Reviewing a youth's individual transition needs and goals will facilitate planning for the youth's eventual transition to an adult model of care and outline the actions necessary to achieve a smooth transition. The goal-setting process gives youth and families an opportunity to provide input about their transition needs, goals, and priorities. Goal setting helps physicians and staff track progress and provide additional support to help patients reach their stated goals. Here is the first group of strategies for incorporating goal planning into a clinic visit. These actions do not need to be done exclusively by a physician, but may be shared responsibilities for the physician-led care team. 1. Start with the transitions checklist completed at the present visit or a visit within the past 2 years. It is a good idea to locate transition planning materials and documentation in a consistent place in the patient's chart. This makes it quicker and easier to find transition information during the visit. 2. Review the transition checklist answers with the teen and family to ensure they understood the questions. This is a necessary step before the goal-setting process begins. Pay particular attention to questions marked, "I will learn." Then, review items marked, "Someone will need to do this for me," and discuss if this is in fact the case, or if the youth could learn this skill over time. Some tasks on the checklist may initially seem daunting because the youth has never before been expected to perform the task. Please continue for more strategies and tips. 3. Transition goal setting should be realistic. Pick 1 or 2 topics from the transition checklist to discuss during a clinic visit based on the patient's and family's priorities. For patients seen frequently throughout the year, discuss transition planning twice a year rather than at every visit. 4. Though the youth may not be legally responsible for his or her health care, the physician should view the adolescent as an active participant in the transition process. This includes involving the teen, as appropriate, in the decision-making process and encouraging the teen to assume increasing responsibility for his or her own health care. These practices are consistent with the AAP policy statement on informed consent, parental permission, and assent. Over time, these efforts will help the adolescent and family grow accustomed to the teen as the healthcare decision maker. Notably, some adolescents will not assume decision-making capacity due to medical or cognitive limitations. In these situations, the family will continue as the primary decision maker. The transition checklist for parents and caregivers will be more relevant to the goal-setting process. 5. Provide a written copy of goals and relevant skill sheets and handouts for the teen or caregiver to practice the skills at home to meet the established goals. Here is a tip for effective goal setting. Use the SMART acronym to remember the components of effective goals. Goals should describe optimal performance standards. Goals should be specific, measurable, achievable, realistic, and timely. Specific goals identify the action or event to take place. State goals as declarations of intention, not items on a wish list. For example, I will do a better job taking my medication, lacks power. I will use my preventative asthma inhaler as prescribed 15 minutes before gym class, 5 days a week for the next 4 weeks, is intentional and powerful. Measurable goals are quantifiable. Achievable goals are attainable given available resources. Realistic goals require some stretch, but allow the likelihood of success. Timely goals state the period in which the goal will be accomplished. I will apply to 3 schools by January 1st. It is a good idea for patients to share their goals with those who care if they reach them. Parents, friends, and teachers can help ensure success. Suggest that the teen write down their goals and put them where they will see them. The more often they read their goals, the more likely they are to achieve them. Let's put the transition goal-setting strategies into action with a patient case study. John is a 15-year-old patient with autism and mild persistent asthma who takes inhaled medications daily. He requires extra academic support at school, but the majority of his classes are mainstream. During a clinic visit, John independently fills out the transition checklist for teens. Here is an excerpt from John's completed checklist. Recall that it is important to review his answers and ensure that he understood the questions. Recall, too, that the checklist is color-coded for early, middle, and late adolescence. It may be helpful to prioritize working on skill deficits accordingly. During the visit, the pediatrician will focus on 2 skill deficits, discuss and agree on goals for John to learn the skills in question, provide relevant skill sheets and written goals to take home, and document the goals and discussions in John's chart. After talking to John about several of his answers on the checklist and helping him prioritize the skill areas most important to him, the skill deficits chosen for immediate action and improvement include does not speak up for self in doctor's office and does not know the names of the medications he takes. The pediatrician provided relevant skill sheets to facilitate the discussion and gave John copies to take home. They agreed that both John and the pediatrician would have assignments for the next visit. Here are 2 immediate goals. The pediatrician agreed to actively direct all discussions to John in future visits, beginning with the next visit. John agreed to ask questions and participate in the discussion. John agreed to memorize his medication list and dosages by the next visit. Remember to keep the goals achievable and realistic. An alternative for patients challenged by these tasks might be to carry medication information in a wallet or on a flash drive and/or to wear a medical alert. If John meets his goals at the next visit, the goal-setting cycle will be repeated until all transition goals are met. Let's move on to the next case study. This one involves a parent. Ms. Brown is the mother and primary caretaker of her 16-year-old daughter, who has cerebral palsy and is cognitively impaired. The daughter cannot direct her care or live independently. During a clinic visit, Ms. Brown fills out the transition checklist for parents and caregivers. Here is an excerpt from Ms. Brown's completed parents' transition checklist. Even for parents and caregivers, be sure to review answers to ensure that they understood the question. Similar to the goal-setting process for patients, the pediatrician will focus on 1 or 2 skill deficits with the parent, discuss and agree on goals, provide a written copy of the goals to take home along with relevant skill sheets, and document the goals and discussion in the patient's chart. The skill area mutually decided as most important to Ms. Brown is advocating for her daughter's rights. By the next visit, she agreed to research and learn about her daughter's rights as a minor and after she turns 18 years old. Recall that goals must be achievable if given the appropriate resources. The office will provide Ms. Brown with the project-developed brochure, Transition Issues for Adolescents with Special Needs, and connect her with a social worker to facilitate her efforts. If Ms. Brown meets her goals at the next visit, the goal-setting cycle will be repeated until all transition goals are met. Let's look at how to improve transition goal-setting processes. The following aim statement expresses optimal care for this key clinical activity. Define, prioritize, and review individualized transition goals together with the patient and family for 70% of patients 14 years and older every 12 to 24 months. Be aware that the AAP recommends this be done annually. You can collect data and measure this KCA via the chart review question, have transition goals been defined, prioritized, and reviewed together with the patient and family within the past 12 to 24 months. If gaps in your practice exist around regularly setting, prioritizing, and reviewing patients' transition goals, here are some potential barriers and improvement ideas to help you close these gaps. Refer to your printed copy of the Barriers and Ideas for Change grid as you work through PDSA cycles. Test ideas you and your team think are likely to succeed and will bridge the gaps you identify. Finally, here are some project-developed brochures, informational handouts, and skill sheets introduced in this module to help you work with patients and families to meet their transition goals. As always, we included them under the Tools tab. Be sure to check for resources in English and Spanish. And here are some informative websites.